Hey friends, do you suffer with low back pain? I did, and my dad and my brother were sitting for long periods of time. It's so important to get up and move. So I'm going to show you this ultimate low back stretch. Feels so good. We're going to get on our bellies, bend our knees, and the movements are very, very small. So we're rocking both feet to the left and then to the right. Releasing the hips. See if you can arch the back just a little bit. Lift up those hips and lift up your chin. Relax the shoulders down here. And then we're going to circle both feet in the same direction, about 5 times clockwise, and then 5 times counterclockwise. Little movements here. Feel the stretch in the low back. Good, and then we're just going to gently tap one foot down and then the other. Just little movements in the air. And then gently bring both heels in towards the buttocks. Oh, that feels so good. Repeat, gently rocking those feet side to side. Oh, good. My back is already feeling better. Remember to get your back pain evaluated. Most cases of acute back pain will resolve on their own. Acute usually is less than 12 weeks. But if it's chronic back pain, definitely look up the source, the cause. Remember, those images that you get sometimes don't always display. There's something called normal, abnormal MRIs. So that means you just take a few people off the street, take an MRI, they have no problems, and they can have abnormal MRIs. So always double check if something's going on. What else could be causing it? Maybe it's tight hamstrings, knee problems. So check that whole body can be affected. Lastly, if you're going to take medications for this, be mindful of NSAIDs, which are known also as anti-inflammatories, like ibuprofen, Advil, Motrin.
What would you suggest if you're not recommending those anti-inflammatory over-the-counter medicines like Tylenol or ibuprofen or acetaminophen, which is Tylenol, or even aspirin? What would you suggest people take?
Yeah, I would suggest, well, first let me explain why not to use them or to be cautious with them. Long term, if you're using it chronically, you can build tolerance, which means they don't work over time. But especially with ibuprofen, Advil, Motrin, meloxicam, they can actually have effects of affecting your digestive tract, increasing your risk for ulcers or bleeding problems, kidney issues, raising blood pressure. It also can impair the immune system or weaken it. The other problem with Tylenol is liver toxicity. These are all real, and there's actually been numerous deaths with these medications using them correctly as prescribed by a physician, just because of the bleeding instances, because people combine them with aspirin or decongestants that also have these added medicines, acetaminophen or ibuprofen embedded in them, and they don't realize how much they're taking of these medications because they're also over the counter. So big picture, what I would use is CBD works really well, and you can get the ones that are topical, patches. You can get tinctures underneath the tongue. It will not get you high or anything like that. It's just CBD. There are reputable brands like Bluebird Botanicals or Miriam's with a Y. We have it at Holistic Relief if you're local. But the other thing that I usually like is magnesium. Turmeric is really good with some black pepper or bromelain, which is what's found in pineapple. The other part is just getting a gentle massage, some stretching like I have for you if you check out our stretching classes on Yoga with Dr. Gold at Dr. Gold's Optimal Living Institute. We also have a whole slew, like people use acupuncture, chiropractic care, many avenues. And the actual benefit, again, for chronic back pain, they have shown if you can, again, treat that root cause as well as work to get your body stronger. So exercise is actually one of the best ways to strengthen your back. It's Dr. Golds with Dr. Golds Optimal Living Institute. Empower your health. And don't forget to like, share, and subscribe to our social media channels. We appreciate your support and love you so much. Toodles.